Hello everyone, my name is Dr. David Amron. Welcome to Lippy Logic at the Lippy Lounge. Today's segment is about the safe plane. The safe plane. I've talked about this concept in so many other segments, and I can't drive this point home strongly enough. The importance of the safe plane. Because really it's where so many problems occur not staying in the safe plane. It is so commonly not respected in liposuction surgery, and it creates all sorts of problems we're going to talk about with things. The safe plane is the subcutaneous plane. The subcutaneous plane is where the subcutaneous fat is. It's where the process of lipedema is manifesting itself in that safe plane between the skin and the muscle. The fat is there, the fibrosis and inflammation is creating problems there, and it's just a simple concept, but it's so commonly not respected, the importance of staying in the safe plane. Let's go to the first illustration. You see the skin on the top, that layer of fat, which is the subcutaneous layer. You see a cannula working within that safe plane there, and this is the safe plane. And going back to things, the main reason that I avoid general anesthesia, we've talked about this also, there are three reasons. Number one is safety, number two is recovery, but number three is really results, is under general anesthesia, when you're lying there intubated in essentially one position, maybe at best being rolled around a little bit, it's impossible to get perfect positioning. And the surgeon many times is in there doing their work and disrespecting the safe plane. And again, that's really the main reason why I avoid general anesthesia. When you go out of the safe plane, you're disrespecting things. On the top part, you're disrespecting the skin. And what that does, if you disrespect the skin with your cannula, you get uneven pullback of the skin, and you create irregularities, indentations, divots, cannula marks, ridging, rippling. All that stuff occurs because of disrespect to the skin by the surgeon from underneath. If you disrespect the deeper part of things, at the bottom part of that layer of fat, you've got a sheet of connective tissue that you don't want to go past. Because if you go past that into deeper things, that creates a lot of problems. And let's run through those problems. Past that connective tissue sheet, which again, the surgeon has no business being out of, but can occur under general anesthesia because of positioning disadvantage, because if you jab past that, the patient's asleep. If you do that under local anesthesia, which cannot be done, the patient is going to feel that, and you just cannot do that. But if you go into the deeper aspect, you're damaging deeper things. Muscle, you're causing trauma to muscle. At a minimum, you're causing bleeding in the muscle, which the muscle itself is full of a lot of blood, and that's a main cause of trauma and bleeding and pain after the surgery. You can also cause scarring in the muscle itself too. I've seen a number of patients who actually had scarring within the muscle, and that occurred because the surgeon had disrespected the deeper aspect and gone into the muscle with things. There's also a lot of other structures that are important underneath that connective tissue sheet. There's nerves, there's important nerve branches, there's tendons. If you're doing areas around the ankle, you're dealing with a very thin layer of fat. It's very easy to go out of that safe plane and damage deeper things like deeper nerves, deeper blood vessels, deeper tendons. In the calf and ankle area, if you go past that safe plane, you get into a deeper compartment, and if there's bleeding in that compartment, can increase the risk of something called compartment syndrome, which is a concerning thing. That cannot occur if the surgeon stays in the safe plane. You can also get into organs too. If the surgeon is doing the torso area and they go out of that safe plane and go into something deeper, the cannula goes askew, you can get into a lot of bad things. You can get into spleens, liver, lung, you can cause a pneumothorax, you can get into the inferior vena cava, you can get into the aorta. And I'm mentioning all these things because they have occurred with things. And that was actually the second cause of death under general anesthesia, where the surgeon has gotten into things they should never get into, getting out of the safe plane and causing concerning issues. And then finally, this whole area of what is called lymphatic sparing. Let me give you my opinions about this. As long as the surgeon is staying in that safe plane between the skin and the muscle, in that layer of fat, there are only lymphatic capillaries in that layer. To cause true lymphatic damage, you've got to get into the deeper lymphatic branches and trunks, which are underneath that connective tissue plane, and get into that with whatever you're using, and potentially damage the deeper lymphatic branches and trunks, and that can cause lymphatic damage. So when this term lymphatic sparing is thrown around, you have to really define what that means. Of course, it means damage to the lymphatics, but it really is damage to the deeper lymphatic branches and trunks that lie out of that safe plane that it's so important for the surgeon to avoid getting out of that safe plane. So again, another very important concept I'm trying to drive home in understanding all this stuff. I'm Dr. David Amron of Lippy Logic. Thank you for joining me at the Lippy Lounge.